to NatrevMD, a podcast where we share tips on optimizing medical billing and improving practice efficiency so you can have the business of your dreams. I'm your host, Dr. Heather Signorelli, founder of NatrevMD. Let's get started. Good afternoon. Welcome back to the NatrevMD podcast. I am excited to have another week with you guys and talk all about MIPS. And before we get into MIPS and really how you can use certain quality metrics in order to earn more from Medicare or potentially lose less from Medicare, depending on what you're doing today and how we can kind of get you guys organized so that it's always the earn more side of things. I wanted to talk a little bit about NatrevMD, why we started and who we are. Just so if you're new to the podcast or new listener, I can give you a little background. So as you may all know, if you have been listening, I'm a pathologist by background, a physician who's been working on the business side of medicine for over 12 years. I actually started consulting on the business side of healthcare during residency and fellowship, even had some moments where I was flying out to other countries doing evaluations of different healthcare companies. And most recently, I've led clinical laboratories and overseen the kind of the business side of medicine in a large healthcare system when it comes to clinical laboratories. Now, we started NatrevMD, which is a full service medical billing company over 3 years ago, really because we saw a need for education, a reliable service, and data metrics, which as a pathologist, I'm a huge data nerd. And we love fixing workflow and operational issues. And as I talked to friends and colleagues, they really struggled with being able to piece all of this together, whether they had an in-house team or whether they were outsourced. And we just really have a passion within our team. And that is our promise to our clients, to be more than just a revenue cycle manager, but to truly understand the workflow issues in the office that may be impacting billing and help address those together. We have over 25 practices that we bill for today and a team of over 70 members. We've grown steady over the last few years and would be excited to help your team. If you are missing out on regular meetings or good communication with your current team, or you don't have metrics that you can trust, please reach out through our website, NatrevMD.com. That's NatrevMD.com to see if we may be a good fit. We've helped many practices just this year increase their revenue over 25% and excited to potentially help you and your team. All right. So today's topic is going to be one that makes most practices really, glaze over, right? It's not the most exciting thing. It's with most things with billing, right? It's not what we're taught. It's not what we're trained. It may even not be what we're passionate about. But MIPS, which stands for Merit-Based Incentive Payment System, is really important. And it's important for you to know what is MIPS, who qualifies, what counts as Medicare Part B, and how you actually make money with the MIPS system. So we'll end the podcast with 5 things every practice should be doing right now so that you can understand how to make MIPS work for you and your team. And if you are seeing Medicare patients and you're not paying attention to MIPS, you could be really seriously leaving out money on the table, or worse, setting yourself up for a penalty. All right. So before we dive into MIPS, I think it's important to understand the broader framework as it belongs to this quality payment program, or QPP, and with regards to Medicare. So this was established under the Medicare Access and CHIP Act of 2015, MACRA is actually what it stands for. And this QPP, so again, that quality payment program, aims to basically improve Medicare by helping clinicians focus on care quality and patient outcomes rather than just the volume of services. Now, I know the cynic in me is like, well, then pay us more, which I get. Not here to debate that today. I think really right now, just really focus on, okay, there is this system within Medicare. How do we manage up to it? So this QPP program, right, within Medicare offers 2 tracks for participation. Today, we're going to focus on MIPS, which is the Merit-Based Incentive Payment System. So this is what tracks adjustment payments based on performance in 4 different areas, which is what we'll cover partly today. And then we're going to do a part 2 of this since it's a lot of material. So again, MIPS is kind of that first pathway. The other pathway is called Advanced Alternative Payment Models, APM. And these models provide added incentives for clinicians to deliver high quality, cost efficient care. And so by participating in one of these 2 pathways, clinicians can contribute to basically a more patient-centered healthcare system, or at least that's the intent, with the idea that you have the potential to earn positive payment adjustments up to 9%. So again, we'll talk a little bit about each of these pathways. First, focusing on MIPS. We'll talk high level today. We'll get more into detail on part 2. And then if there continues to be interest around this, I'm happy to do more around that advanced alternative payment models. Again, these are very detailed programs. There's a lot of information, really good data and PowerPoints and tools you can use on the CMS website. So again, as always, this is educational purposes from the materials that are off the Medicare website. So please head there if you want more detailed information. All right, so let's start with the basics. MIPS stands for Merit-Based Incentive Payment System. It's basically how Medicare decides whether to reward or penalize clinicians based on how well they're delivering care, not just if they're delivering care. So, of course, if it's not documented and in this case not reported, it's not done. So it was basically created to replace previous programs that were out there that had value-based modifiers and meaningful use, and basically rolls them all up into one big program. Now, MIPS is part of that quality payment program that we talked about earlier. And basically, it's just a way for them to say, we'll pay you more if you do a good job and document it, right? And we'll pay you less if you don't, which is annoying, but it is reality. So not here to debate that today, just really here to show, talk about these programs. So MIPS has 4 different qualities that you are scored in: quality, promoting interoperability, improvement activities, and cost. So quality is about clinical outcomes based on measures like blood pressure control or diabetes. And these are, again, things that we'll talk about in more detail in part 2. And there are tools online for you to be able to select and say, okay, these are the tools I'm going to use. These are the ones that I'm going to submit. Now, promoting interoperability basically are you using your EHR effectively and securely? Then there's improvement activities. So what are you doing to improve care process or outcomes? And then cost. How expensive is the care you're providing compared to your peers? And then at the end of the year, you'll get a MIPS score out of 100, which is then basically what is used to affect future Medicare payment. So, for example, a provider who gets a score of 88 might have a positive payment adjustment, whereas somebody with a score of 50 could get a penalty. Important that we're talking about Medicare Part B with physician services, outpatient services, lab tests, diagnostic imaging, even DME like walkers or CPAP machines. So basically, if you're in an office, you do take care of Medicare patients, you maybe even do minor procedures or chronic care management or even telehealth visits, then if you're billing for these services to the insurance, then you are likely potentially qualify for MIPS. And we'll talk about qualifications. There are some kind of thresholds in terms of whether or not you're required to participate in MIPS. And so if you meet all 3 of these thresholds, then you may be required. And you can actually check using your MPI number, whether you're required. You can just go onto the CMS MIPS website, and actually at the very bottom, there's a place where you just type in your MPI number and it'll tell you whether or not you're required. So number 1 is you bill more than $90,000 a year to Medicare Part B. You see more than 200 Medicare Part B patients in a year, or you provide 200 or more covered professional services annually. So some examples like this are solo family medicine doc who sees 10 to 15 Medicare patients a week, likely qualifies. A group of orthopedic surgeon performing total knees and billing Medicare, definitely qualifies. A podiatrist even in a small town seeing a lot of diabetic foot care patients on Medicare will maybe qualify. Again, depends on that patient volume and the dollars billed. Now, of course, if you're unsure, go to that lookup tool so you can check and find out. You do need to check and should check every single year, just in case you do have fluctuations or changes in volume or patient mix. All right, so now let's talk about how MIPS affects your money. So your MIPS score, again, that 0 out of 100 is going to determine how much of a bonus, essentially, or a penalty you will get on every Medicare Part B dollar. So let's break it down. MIPS adjustments are going to range from -9% to +9% at the time of this recording. But that bonus pool depends on how many people are penalized. So even top performers may only see a 1% to 2% increase. So to me, it's funny math and you may not even know, but the idea is to get as high of a score so that you can get that 1% to 2% bonus. And if you are billing, say, $500,000 a year in Medicare, again, as a receivable, even a 2% bonus is a $10,000 amount back into your practice. And now a 5% penalty would be a $25,000 loss. So again, important to understand this, important to know if you qualify, and you need to be submitting these things so that you don't get penalized and that you could potentially get that bonus. So again, the whole trick here is basically to score above the performance threshold to avoid those penalties and aim for higher potential bonuses. So let's talk a little bit about some MIPS metric examples, just so you can understand some examples that are out there. And again, there are some amazing tools on the CMS website that you can go to for each of these 4 areas, and you can plug in your specialty. You can download information of metrics that you can choose for, because an ophthalmologist is going to have different metrics than, say, a family practice physician, at least for some of them potentially. All right. So some examples are, let's think about a family medicine practice. So some quality metrics that are common and some ones that are easy to track are controlling high blood pressure. So did your hypertensive patients keep their blood pressure under control, right? Less than 140/90. For your diabetic patients, do you have hemoglobin A1C with poor control, meaning what is the percent of patients that you have that have hemoglobin A1C above 9%? Very high, right? So lower the rates of those types of patients, the better the scores. And then things like breast cancer screening, do you have your patients screened who are in between that age of 50 to 74 for breast cancer, colorectal screening for those patients between 50 and 75. Again, some straightforward EHR flags that you can use to check and make sure that, these patients did get their screening, and that you can show that of the total patients that you have in that patient population, your percentage of that is high. Depression screening and follow-up plans, of course, screening with that PHQ-9 to document your plan, and this actually counts. Now, some improvement activity examples are the ability to use telehealth services or care coordination through patient outreach, integrating some sort of behavioral health program into your primary care. And again, these are just a few things. There's more details on that CMS website. And next podcast on part 2, we'll dive in a little bit more in each of these activities and kind of what it means and so forth. Again, today is just high level to give an overview. So these are just some of the things that primary care practice already is, likely doing. They just need to document these things and then report them correctly. Now, for our subspecialist group, let's take, for example, orthopedics. Some quality metrics may include things like documentation of current medication. Obviously, this is super basic, but it's often sometimes missed in a subspecialty group. A functional status change for patients with hip knee replacement, meaning documenting, how things are going. Use of imaging studies for low back pain, making sure you're not overutilizing advanced imaging too early. Pain assessment and follow-up, especially relevant in the post-surgical or those with chronic pain. And again, easy things to have, most likely already in your notes. It's just a matter of documenting these things and submitting them. Now, some improvement activities for that orthopedic practice may be implementing decision support tools for imaging or surgery, basically just making sure you're utilizing those appropriately, or patient safety initiatives like opioid prescribing protocols. So participation in that qualified clinical data registry, right? So the key here is that you don't need to report on every single measure, just the most ones that are relevant for your practice and patient base. And a lot of EHRs actually help track this for you. So again, you're going to have your EHR tool. You're going to pick your quality metrics or your improvement activities. You're going to pick the things you're going to measure, and then use your EHR to collect that data, and then submit the amount that you need to submit through that qualified clinical data registry. So again, there are easy ways to do this. It's not as painful as it sounds. You do need somebody, typically it's an office manager who's helping kind of pull this together together with your EHR. So a lot of EHR programs have this, and even some EHR programs have a consultant that can help with this, should that not be something that your team is very familiar with. Now, let's talk a little bit about that EHR and how they can be used to track MIPS. A lot of the EMRs already have built-in MIPS dashboards. They have templates, they have reports to help you track in real time. So we've seen these in ECW, we've seen it in Epic, Dr. Chrono, we've seen it in Advanced MD. And so there are likely MIPS modules or some sort of expert that can be used to help you build this out. Oftentimes that may be an additional charge from a consultation perspective, but usually the sales team can help show you where they are. And if you need that extra help, a lot of them offer that. I would be surprised if it's super expensive, but I've honestly not looked. I'm going to give you a list of kind of some of those things that can be built within EMRs depending on your system. So they can have pre-built templates or documentation. They can have point of care alerts or screenings, basically flagging like, hey, did you do this? They can have automated data aggregation for those quality and promoting interoperability metrics that you need to submit. They can either have monthly or quarterly reports showing you where you're at. So if you are falling behind, you can correct for that. And many of these actually integrate with the qualified registries or those data registries where you have to do the submissions. So it is easier to submit. So if you are a family medicine doc and you've got an EMR flag, it could tell you that 66-year-old woman who hasn't had a mammogram in 2 years to make sure that they go get that mammogram or that you remind them. So lots of things that can be done to help make sure that you are participating and that you're qualifying for as much as you can. Now, it is important to understand that whether you participate in MIPS as an individual or as part of a group is crucial, and it does affect your performance and how it's measured and how payments are adjusted. So individual participation, right? So that's your performance is assessed solely based on your own data. You report independently. And this is ideal if you want full control over your reporting. Now, group participation is defined as clinicians billing under the same TIN number. Now, everybody receives the same MIPS score and the same adjustment. Now, this is helpful if your group all agrees to participate in the same approach to quality. Obviously going to be a little bit more difficult if you have different views on how to participate in MIPS. So something to consider talking with your group about. All right. So lots of information today. I know it's a lot of detailed information. Again, head over to that Medicare website to check if you are eligible to participate, if you should be collecting this data, and you're going to be wanting to check that eligibility every single year. So head on over there and check out that lookup tool. Then you're really going to want to focus on picking those measures, right, that make sense for your practice. Choose what reflects your own patient population. Number 3, you're really going to want to track this throughout the year, not just at the end. Set up those dashboards, work with your EHR team, figure out what metrics you're going to do, and then monitor them maybe on a quarterly basis. So if you are falling behind, you can get that corrected. And don't just ignore these different activities. The improvement activities we found is to be easy to overlook, but is also easy to score. So you'll want to make sure that you are looking at all 4 of those activities and making sure you're submitting information for each of them. And then last, of course, partner with somebody who really understands MIPS. If your practice is looking for a consultant, we do recommend, starting with your EHR company, starting to understand what services and reports that they have offered to you and your team. Do they have consultants on hand? And of course, if you do have questions, head on over to NatrevMD.com, and we're happy to direct you in the right location. You can also reach us at info@NatrevMD.com. All right. Bottom line, this isn't going away, and likely is going to be something that we continue to see as, this push for value-based healthcare continues to move across. Certainly, head on over to the website and see if you qualify. And last, I'd love if our podcasts have been of help to you, please, find 3 friends, 3 other folks that you could share this podcast with. It helps us increase our reach and make an impact. Have a great day.